Yeah, we're doing 2 studies on MS, both of them very relevant to the conversation we're having here today. The first study is called CAM Care in MS, and what that is a prospective observational longitudinal study where we're looking for as many people as we can find from all over the world who have a diagnosis of multiple sclerosis or anything like it. There's this amazing body of literature from the last 50 years, beginning with Roy Swank's first study in 1952, where he did his "What Are People Eating That Increases or Decreases the Risk of Developing MS," and he concluded that butterfat, pork, beef were associated with increased risk and fish consumption was protective. Since that original study, there have probably been 20 or 30 other studies that have happened in 20 or 30 other countries around the world that have kind of said the same thing. The problem is we're not using that data. I mean, there are no public health campaigns telling people avoid beef and pork so you don't get MS. We have this neat, insightful data that is not helping anybody, because what happens is when a patient gets diagnosed with MS, they go to their physician and say, should I change my diet? And the physician has every right and is absolutely correct in saying there is no evidence that once you change, if you already have the disease, changing your diet is going to drastically change the outcome. Mm-hmm. And it's not because it won't, it's just because the studies haven't been done. What we're doing is flipping it forward, kind of translational medicine. Let's take all the things we know about diet and ask people who already have the disease, who are you, how are you, and what are you doing? And what we've done is written a little bit of code to help us find who are those people that are doing really, really well. Their quality of life is high, their disability is low or non-existent. Who are those people and what are they doing differently than the people who are winding up with a progressive disease and some paralysis? We have set up this study that will kind of shed insight on this whole question from a new angle. Okay. So people can go about their life, do whatever they want, and every 6 months we send an email and say, hey, will you answer these questions about how you've spent the last 6 months? How often did you eat cucumbers and milk and cheeseburgers? And we just ask all these questions, and we're trying to figure out what is the recipe for success. And we already have several hundred people enrolled. Our target is to get to 2,000, and we thought that would be the place where we would begin to get statistically significant information. And I can tell you, we are already getting statistically significant information with a few hundred people in the database. So every person who enrolls, the data becomes more and more accurate. There's no limit to the number of people who can enroll. It takes a total of about 3 hours per year. Yeah, it's okay. Like an hour to an hour and a half every 6 months. You do need to be computer literate and have an email address, but the entire thing is computer-based, free. We don't give you money, we don't charge you any money, we just ask you to please let you be our teacher. You teach us what you all are doing out there in the world. You tell us what you're doing. Let us write the code and find out, is any of this making a difference when you pull everybody together?